PPI, but I would like to suggest it's not more superior to your PPI. So that's one point I would like to add here. And based upon the other indications, most of the time, your, for example, your QT prolongation, your neurological events, all those things, one person will be having a potential events and compared to your PPI. And regarding the GI trigger, for example, irritable bowel, diarrhea, and other complications, combining the role with prokinetics and other things, how far your PPI and one person is going to get different, that we need more and more papers to document, sir.
Okay, now I think there are a lot of PPI there. This is one thing, you can have a photo click of this. This is what a pharmacological comparison between vonoprazan and PPA. And it's too early if you ask me what is your experience, and too early, anybody's experience will be like that. We have to quote the experience from Japan, Korea, UK and USA, only we have that. I think we need to have our own data. I will tell you what we are going to do that. So this is what the one distinct advantage is, maximum time to reach maximum acid suppression is 1 day in vonoprazan, but it takes 3 to 5 days in PPA, and maintains pH more than 4 in 62% of the time in vonoprazan. But rest of the thing, it is not as high as this. And this is another tabular column will tell you that they already Dr. Gopal has nicely pointed out holding time, whatever that more than 4 is more with the vonoprazan. Now this is a very interesting question. Many people, the family physician, general practitioners, a surgeon would particularly ask. So in surgical practice, how do you feel, Dr. Balamurugan, how commonly used PPA and where you feel vonoprazan has got a better role compared to this? What is your opinion about that?
Mainly, in surgical point of view, most of the patients with when you do a Billroth 2 reconstruction of following gastrectomy, or especially when we do a sleeve resection for obesity, these patients, these sleeve patients usually post bariatric surgery, they have an increased GRD than before the surgery. So those patients sometimes, if they are not at all responding to this PPI, I have tried this vonoprazan, and in some patients, especially post gastrectomy, when GJ was done, the patients, they have a stomal ulcer, they have a stomal, sometimes the marginal ulcer with bleeding. So those patients, PPA was given. If they are not responding, I would suggest them like.
Your main thing is when the PPA is not responding, or right from the beginning PPA is less likely to respond. Closer